Well, every Thursday, we invite you to phone in your medical questions and concerns, and we've got a ton of them. Dr. Kalani Brady from the John A. Burns School of Medicine joining us now to answer them. Good morning.
Good morning, Ron.
Welcome back. All right, let's get to them. I was given beta blockers to take twice a day. What's the purpose of beta blockers? Is it all right to skip the morning dose?
Beta blockers, Ron, are used for many things, including high blood pressure, heart disease, sometimes even migraines. And there are once-a-day beta blockers. So if this patient is having trouble remembering to take the pill twice a day, talk to your doctor about a once-a-day beta blocker, and then you don't have to worry.
Okay. I have numbness in my feet due to diabetes. What's happening?
Numbness in the feet is common with diabetes and can be improved in some people with tight control of the diabetes. Unfortunately, it is common, and sometimes numbness is better than pain.
Right. When my husband gets up in the morning, he's dizzy. Is it serious? What's happening?
It could be serious. I would recommend going to see the doctor and finding out whether it's just dizziness with age and getting up, which is called orthostasis, or whether it's something serious that should be worked up further.
Okay. When you have a nosebleed, is your pressure too high? Does eating salt contribute to high blood pressure?
Not all nosebleeds are due to high blood pressure. Obviously, when we're kids, we have nosebleeds and we don't have high blood pressure. However, some are, and the way to find out is to take your blood pressure when you're having a nosebleed. On the other hand, salt almost always raises blood pressure, and if you're in the borderline hypertension category, you should be avoiding salty foods.
Okay, I have pain on both of my hands from my thumbs to my wrists. Is this arthritis? What do I do about it?
It could be arthritis, Ron. It also could be carpal tunnel syndrome and other conditions. So I would go into the doctor and have it diagnosed because, of course, in some cases it can be treated and relieved.
Okay. What does it mean when my muscles cramp up when I walk and the cramps go away when I sit?
That's called claudication. And claudication is usually a sign of peripheral artery disease where not enough oxygenated blood is getting down to the feet and legs. And so that can be serious. I would go see the doctor and have that worked up.
Well, thanks for asking that question. I want to start taking my blood pressure medicine and do it holistically. What do you think?
I think if you're on high blood pressure medicine, to lose weight and avoid salty foods and watch your blood pressure come down might allow you to stop the blood pressure medicine. But just stopping it on its own, blood pressure is called the silent killer for a reason, and you may end up with a heart attack or stroke. That's not worth it.
Yeah, check with your doctor before you do anything. What causes bruising on the arms of an 81-year-old man?
When we age, Ron, our blood vessels become more fragile, and there is a condition called benign capillary fragility, where even a seemingly innocuous knock against furniture or a door or something like that can cause bruising. It's not necessarily dangerous, especially if it's on the places where you would knock things around. If you have bruising all over your body, you should go in and have your platelet count checked with your doctor.
A lot of times we see that on our kupuna, on their arms.
Yes,
and
indeed.
it can look bad, but just check with your doctor as well. I want to sneak in one more question. I have a fractured rib on my upper right area for a month now, still sore. Should I go back to the doctor again?
I would. I would. Why suffer? And let's say that something else is going on.
Okay, one more question. I live in a condo unit in Marco Polo. I'm concerned about asbestos. How safe is it?
I live in Marco Polo too, and it's pretty safe. They did asbestos testing, and I would go to the management office and ask them for their asbestos testing. But generally, there is no exposure to asbestos in almost all the units.
All right, very good, doctor. We got through a lot today.
Yes, indeed.
We did very much. Thank you very much. You're going to stick around for take two?
Absolutely.
The topic today?
Cholesterol.
Cholesterol. Everything we need to know about cholesterol.